Hi everyone, welcome back. So today I am going to be doing another sports related post. And this is actually something that I have had clients come in with before. And I don't think I've ever truly appreciated just how painful this is until a couple of days ago. I've basically spent the last couple of days having ice packs on my foot and waking up and not even being able to walk on one of my feet. And that's because I seem to have developed plantar fasciitis, which, is surprisingly painful. So I'm going to be talking about that today, about what causes it, symptoms, how you can treat it, and maybe a few sort of exercises or stretches you can do to try to relieve it. So it's one of the most common causes of heel pain, most commonly causing pain on the inner edge of the heel and going round into the back. And it's basically caused by inflammation of the thick fibrous fascia that runs along the sole of the foot, connecting the heel bone to the toes. So this fibrous tissue is called the plantar fascia. And so this is it here. You can see running from the heel bone right the way along up to the toes, along the sole of the foot. What happens with plantar fasciitis is that you get inflammation of this tissue, and the reason it causes pain is, besides the inflammation, is that where it becomes inflamed and tightened, it actually pulls on the heel bone here. I will talk a little later about the calf muscles involvement as well in this. Obviously on the other side of the heel here, going up past the ankle and into the bottom of the calf, you've also got the Achilles tendon, which if that's tight, if you've got like calf tightness, will also pull on the heel bone from the other direction. So hence why you can then get pain around the heel. So what are the causes of plantar fasciitis? Well, the plantar fascia acts as a shock absorber in the foot, around the arch of the foot, and basically too much tension around that area and on that tissue will result in just small tears to the fascia. And repetitive tearing to this tissue can then cause inflammation and consequently pain. So any sudden stretching or overuse of the foot and the sole of the foot in particular. So things like sprinting. If there is a sudden increase in speed or distance, or the intensity, that can put extra stress on the sole of the foot. Any jumping, sports or activities, or where you're landing on a hard surface, will also, again, it's increasing the impact on that fascia on the sole of the foot, and the impact through the arch of the foot. It will increase the chances of tears and inflammation. So there are numerous risk factors that that can mean that your risk of developing fasciitis is increased. Age, certainly, it seems to affect people more commonly between the ages of 40 and 60. Also anyone who is has suffering with obesity, or even just being overweight. Any extra weight is going to put extra stress on the foot, so that's again going to increase your risk. Any overuse, as we've said, through certain types of exercise, any exercise that places extra stress on your heel, and on the attached tissues surrounding the heel. So we're talking about particularly the Achilles tendon and the plantar fascia. So this, as we said, could be things like long distance running or sprinting, anything where there's any sort of ballistic jumping activities, and also dancing, whether it be more of an aerobic form of dancing or something like ballet dancing, which again, you've got the jumps, and quite often landing on a hard surface. So that again will increase your risk. But not just sports, your occupation as well can affect your chances of developing plantar fasciitis. Anything where you're standing on your feet for prolonged periods of time, such as I am with my job. But also, people, factory workers, hairdressers are well known for developing plantar fasciitis, and it's because they're spending long periods of time on their feet. Tight calf muscles, definitely, if your calf muscles are tight, they're going to pull on that Achilles tendon at the back of the sort of ankle, which will pull on the heel bone, and then that will pull on the fascia on the other side, on the underneath of the foot. Also, some sort of other issues with the feet will increase your chances of developing this. So one of those things, which I have, is flat feet. So if you have a collapsed arch, then it will. People with flat feet tend to stand with more turning the feet inwards, and the weight will be distributed differently, to someone who has normal arches. So for people with flat feet, it's really important, to make sure that your shoes are supportive and, well cushioned, that you use arch supports in your shoes, and something that I've just gone out and bought, so hopefully they will work. And but also other foot issues, so things like pes cavus, which is having a particularly high arch in the foot, or anything where you have maybe a slightly abnormal walking pattern, because all of these things can actually affect how the weight is distributed across the foot when standing, and will therefore increase stress on certain areas of the foot and on that fascia that runs along the sole of the foot. Symptoms, how do you know when you've got plantar fasciitis? Probably the biggest symptom is stabbing pain in the sole of the foot, and certainly around the heel, particularly on the inner side of the heel, and up sort of going into the arch of the foot, and it really hurts. So it's usually worse on standing first thing in the morning. As I said, for the last couple of mornings, I've not actually been able to walk on it at all for about the first 10 minutes after getting up. It will also get worse if you have periods of prolonged standing. So as I say, with your occupation, that may well be an issue, or even just getting up from sitting down. Pain is usually worse after exercise, but not usually during. In fact, exercise can, in moderation, can help. There is often sort of the pain will usually be a sort of gradual onset, although I have to say mine was actually really quite sudden. As I say, walking short distances, just sort of moderate exercise can help improve the pain, but longer distances probably will increase the pain. So you just got to know your limit, really, because you don't want to make the inflammation worse. Pain will also be worse, certainly, if you are wearing unsupportive footwear, or if you maybe don't have arch support. Certainly walking around, if you walk around home barefoot on hard floors, that is really going to increase the pain as well, because there's going to be more impact through the foot. You may also get pain if you suddenly stretch the sole of the foot. So things like if you suddenly stand on your toes, or if you're walking up and down the stairs, that may also be quite painful. So how, once you know that this is what you have, how can you treat it? So it actually usually resolves itself, but certainly there are things that you can do to try and minimise the pain, relieve the inflammation, and just kind of resolve it a little bit quicker. So obviously avoiding any activities that will make it worse, but this is easier said than done, especially if it's sort of related to your work. If you're standing on your feet for work, it makes it kind of difficult. So I guess that's where the shoe supports really come in. Avoid, walking around barefoot on hard surfaces. Make sure that you've got plenty of cushioning in your shoes, and hopefully that will kind of help sort of absorb some of the impact, when you're walking. As with all pretty much sports injuries, I always recommend the RICE method, which is what I've been doing. So rest, preferably for a few days, but as I say, it's not always that easy, with work. Ice packs. I've been doing ice packs for kind of 15 to 20 minutes at a time, roughly every 1 to 2 hours, and that has really helped ease that inflammation. I've also compression is the next thing, and I've actually gone on good old Amazon, and you can get like a compression, sort of like a tuber grip or a sock, which just really helps to support the foot and the heel, and also just help to some of them help to improve the circulation, around the foot, which is also going to help with that inflammation process. You can also get, I saw on Amazon, you can get actual splints, which are mainly designed to wear at night. And they just keep the foot in a flexed position, which is going to help sort of stretch out around that Achilles tendon. But as with all splints, I would not recommend, you don't want to be wearing them all the time, because actually that can then weaken a lot of the muscles around that area, which could then worsen the problem. So I'd say if you're going to do that, maybe use them for night, but not during the day. And then elevation, just where possible, keep your foot up, again to help assist with the circulation really and ease inflammation. When the inflammation is sort of bad, you can take anti-inflammatories such as ibuprofen, but obviously do be aware that they are a gastric irritant, so you must eat something or take milk with them. And if you've got any history of gastric ulcers or anything like that, do not take them. And also asthmatics sometimes have to be careful of something like ibuprofen. We have also spoken briefly about making sure you've got foot support, wearing shoes with cushioned heels, a good arch support, using soles if need be, just to help sort of balance out the weight distribution on your foot, and therefore help you to walk with a good sort of gait, and just so you're not getting too much stress on one area of the foot. As I say, exercise may improve symptoms, but certainly don't go overdoing it because it will make it worse. So, even if you are on rest from a particular activity, still maintaining gentle walking, will help. But if symptoms persist past 4 to 6 weeks, I'd say then you want to be looking at getting some advice either from your GP or from a physiotherapist. Physiotherapists may offer cortisone injections if it is a severe case, or if you are repeatedly getting it and nothing really seems to work. Cortisone injections can be helpful, but I would say certainly try the massage and the exercises and the shoe supports first, because they can actually be very effective. Massage, when focused on the arch of the foot and the calf muscles, may offer a fair bit of relief. If the calf muscles are tight, then working on, that's going to help relieve tension on that Achilles tendon, which can then pull the heel bone up. And certainly, orthopedic consultants that I've worked with, and there's a lot of research as well out there, showing that they actually recommend working on the calf muscle, and that can be more effective often than some of these basic stretches that you get for the sole of the foot. So, but I would say actually working on both the foot and the calf is actually the most effective, and it's basically hitting the problem from both ends. So that's pretty much the treatment. As I say, there are some stretches which I'm going to go through now, which can basically reduce the tension in the foot and calf, and help reduce pain, and gradually then improve improve the symptoms. Okay, so as I've said, calf stretches really are the way to go. And so this is sort of a basic calf stretch that you can do, just standing up against a wall and bringing one leg back with your foot flat on the floor, and you'll feel a stretch right down here along that Achilles tendon and into the calf muscle. There are other calf stretches you can do, like heel raises and drops on the edge of a step. I will actually in the future be doing a video on specifically on calf muscles and injuries there, which will also include a lot more calf exercises. But you know, this is a good basic one, you know, that is effective. So yeah, I'd say just go with this one. Okay, the next one is basically taking a ball under the sole of your foot and just rolling the ball forwards and backwards under your foot will just help to stretch out the sole of the foot just a little bit and work on that fascia. Now you can stretch the plantar fascia as much as it can be stretched, obviously being, you know, thick fibrous tissue, you know, it can't be stretched in the same way that muscle can, but you can just work, you know, along the sole of the foot all the way along, or likewise, you know, you can see a therapist such as myself who can work on it, you know, in a foot massage. But also if you're doing it yourself, by pulling the toes forward, you can actually also create some tension just here in the arch of the foot. Again, that will just help to sort of stretch out all that tissue a little bit better. But as I say, you know, a lot of people will say do this and this is like the main stretch, but actually on its own this isn't going to do a huge amount, so it really needs to be used in combination with you know, some muscle work on the calf and the Achilles tendon also. Foot flexes. Obviously, if you flex the foot, what happens is you create not only a bit of a stretch along the sole of the foot, but also along that Achilles tendon, leading up into the calf muscle. So you can either do it like this with the use of a towel, you know, or you can just, as you're sort of sitting or laying in bed, you can just flex your foot upwards, and that will give you that stretch. Flexing the foot not only relieves tightness in the calf, but it will also help to increase the blood flow around the foot, which will, you know, be helpful in, you know, resolving the inflammation around the foot as well. And then finally, toe curls. So you can do this just using maybe a tennis ball, or even using the toes just to grasp the centre of a towel on the floor. And that again will just work that fascia along the sole of the foot. Now, as I say, you know, the foot exercises can be helpful, but, you know, certainly working on those calves as well can give further improvement, and this is recommended by orthopaedic consultants. But, you know, looking to the long term, once you've had plantar fasciitis, you're more likely to get it again. So just using those preventive measures like the, you know, shoe supports can really help. You know, plantar fasciitis if left untreated, it can cause chronic heel pain, which, can eventually make just normal daily activities extremely difficult. So it's really important to get some treatment, and do all the things that we've suggested today in this video. Some people think that just by changing their walking pattern to compensate for the pain in their foot may help, but actually, if you start limping everywhere, that's then going to result in further issues with not only your feet, but your knees, your hips, and your back. So, a few simple methods that we've spoken about today can really help, resolve the problem. And so that's really where coming to see someone like myself and having a massage, a good firm massage around the calf muscles and the foot, will really help. But obviously, you wouldn't be wanting to do that when the pain is really bad. And when the inflammation is really bad. So the idea is do your rest, ice, compression, elevation, and then when the pain and inflammation have eased a little bit, then go in and have the massage and do these stretches as well. So that is just about it on plantar fasciitis. As always, any questions, feel free to contact me, either comment down below or contact me through my Facebook or Instagram, and I will do my best to answer your questions. Subscribe. There'll be more videos coming up on different muscles. As I say, there will be a video coming up on calf muscles and exercises and stretches that you can do for those, as well as dealing with any injuries to the calf muscles as well. And so if you subscribe, you will be notified when they come online. But for now, that is all from me. So I will see you next time. But for now, take care and bye.